before to protect sexual health and rights and to promote sexual health and rights, to protect, to guard, and also to promote. And that means thinking about all the aspects of this protection and promotion, thinking about the framework of rights and its importance, thinking about the equity and its importance, and of course the justice, promoting and elevating the meaning of pleasure, not only as a value, but as also a lived experience. But at the same time, assuring that sexual health is part of the integrated care and services that we're gonna push forward. It's also part of it works towards the inclusivity of everyone and leaving no one behind. And it's also about holding ourselves, as I said, accountable, not only to the people that is claiming to serve, but also accountable to our own mandate, accountable to our own codes and values, that we are here in Porto to do this. And another thing also in Porto, that every representative of these amazing agencies were so keen that we have to move forward. We're so keen that to give what does it take in terms of collaboration, in terms of sharing, in terms of generating knowledge, in terms of funding to move forward, because besides history and besides the pledge, and I think what happened in Porto is also a beginning of a movement. We're not like meeting 30 people, writing a piece of paper, and it's a proclamation and that's it. It is a movement that's gonna galvanize, that's gonna bring more members, they're gonna bring more agencies, they're gonna bring more individuals, they're gonna bring more universities, they're gonna bring more people who are concerned with this to work together, and we're gonna be doing this on every occasion, during every global meeting. We're gonna be meeting every year as a World Sexual Health Assembly, but also we're gonna be talking about this, advocating this in all the upcoming meetings. I'm sure you know there is the International Conference on Family Planning coming up. There is also meetings on sexual medicine and sexual health coming up also next year. We're gonna be also in Nairobi, the second World Sexual Health Assembly that will be around the World Sexual Health Day in September 4. So this is a movement that's going to grow. What I want to say at the end is that WAS, in leading this movement, is taking not only itself as WAS into another level, but it's also taking the thinking, the dynamics, the energy, and the pivotal role for promotion of sexual health into another level. I want to thank you very much for being with us. I want to thank again all those who joined us in Porto, and I'll be happy now to listen to the next panelist. And I have here on the list Christopher, I think Elna. I have Elna. Elna has been really the dynamo behind this. It's probably the brainchild of Elna, who started thinking around this sexual health assembly more than a year ago, probably a year and a half. Elna, besides being my very good friend and inspiration, although she is much younger than me, but you can always be inspired by people in various ages, positions, countries, and places. She's the past president of WAS. She's also the chair of the steering committee of the World Sexual Health Assembly. And she will be talking also about some reflections, sharing of her perceptive experiences of what happened in Porto. Elna, you have 8 minutes.
Thank you very much, Faysal. And it's an honor for me to be here. Thank you for all the participants for joining us and also the panelists. So it was last year around the time of the World Health Assembly that we had our annual executive committee meeting at WAS in Bologna, and the advisory committee meeting was actually also there. And it was also at the time where there was growing polarization, misinformation, disinformation, rollbacks of rights and services, and the political climate was already starting to change. I think very few of us could imagine how much further it was going to change, how much longer wars were going to go on, and how much more damage could be done. And we realized as was that it is time to do something. And it was also evident right from the start that we've done a lot so far. And all the sexual health organizations over decades have really made very hard-earned progress when it comes to sexual health and rights. And that we had to build on all of those positive aspects of what we had already achieved and not only stare ourselves blind into the negative things that were happening around us. And one of the things that we can do at WAS is we really have remarkable convening power. And if you bring an idea to the executive or advisory committee of WAS, the wonderful thing about WAS is that it really comes out much greater on the other end than what you had ever anticipated. So we were together in Bologna, and the idea of a World Sexual Health Assembly was raised. But then after that, we had multiple conversations. Esther Kismodi played a big role in conceptualizing this from the start, as well as did Alan Jami and Louise Perelman that were on the previous advisory committee. But slowly but surely, we started to develop the idea. And Pedro Nobre, that was also our past president, said that he could host us in Porto at the University of Porto. His rector gave the funding for this event, and we could start planning. And there were a few comments of, do you really think you're just going to invite 30 of the most leading organizations, the most important people in our field, and they will just pitch in Porto? Yeah, I think that everyone sees the urgency here. And as we started inviting, we were really pleasantly surprised by the response that we got. We had the key UN agencies in the room as observers. We had the professional organizations. WPATH was there, from the president of WPATH, the president of ILGA, the president or elect of ISWICH, the International Society for the Study of Women's Sexual Health, and came as observer for the International Society for Sexual Medicine. And they came into the room, actually, some of them for the first time, with the leading civil society organizations, and definitely for the first time with the universities that do the professional training of all of us who are professionals in sexual health and rights. And all of us could be in one room and really bring to the table what we had already been busy with and learning from each other to see how we could further develop trust. So that came about by putting together a steering committee within WAS that we had regular meetings to identify the people that needed to be in the room and to strategize about what this should look like. And Faysal was on that steering committee even before he became president of WAS, and as was Esther Kismodi and Eli Coleman and Esther Corona also from WAS, and then as I mentioned, Alan and Luis and Pedro from the previous administration. And then in the next administration, Erik Janssen then also joined us and put this together. And really the kingpin of all of this was Renee, our executive director, because there's one thing for a few people to sit in one room and say, oh, we think we should be inviting these people, but to then actually get all of them on airplanes and get all of them in hotel rooms and figure out what to wear even and where everyone had to go. It is really a massive organization to do it in such a short period of time. So thank you to Renee, who pulled all of those logistics together in such a short time, and also remarkable support from the University of Porto. But as you can imagine, we could not have done this without first the support of the WAS Advisory Committee, Executive Committee, and the General Assembly. We had to present this project to them as well. But then when all of that was authorized, it's impossible to do this without money. And we have at WAS, we have an anonymous donor who that comes to us through a relationship with Eli Coleman, who has supported us tremendously with projects in the past. But this anonymous donor came forward with a $30,000 donation and said that if we could match it, he would give it. So it wasn't just an upfront donation, we needed to raise the funds. So in Australia, when we had our World Conference, we launched the project there, and we got the people that supported us for the Congress, that came there to learn, the passionate professionals. We got them on board first, and they became the inaugural donors of the World Sexual Health Assembly. And I'm also just here to thank each and every one of them, whether you gave $100 or $1,000 or $5,000 like Eli gave from his wedding money. It went towards the start of something that I really hope and believe will be here for decades to come, and will bring meaningful change. So I think that for me, the biggest takeaway from what happened in Porto was when Julia Erard from Elna said that organizations work together, and we often have meetings where organizations meet. But this was a very special group of organizations in the same, or unique constituency of people in the same room. But what she said was that ultimately it's people that work together, and people need to trust each other. And if you don't get into a room with each other, share those meals, sit next to each other, build those relationships, you cannot build the trust. And in a time where there's such massive attack on our field, there is immense importance on the trust that we build amongst ourselves in order for our organizations to trust each other to do what the organizations can do. Because on the other hand, no individual can do this work alone. We need each other. We need each other's friendship and support, and we need each other as a moral compass and as cheerleaders to get this work done. And it has been an absolute honor for me to see all of these people in one room and see their dedication to that particular mission. And then, as Faysal said, we have the proclamation was signed, and everyone is on board to keep this assembly going. The next assembly will be on the 4th of September in Nairobi. The AMREF University has already agreed to host us in Nairobi. So I am, of course, as a person from the African continent, very, very happy to host it on the continent up next. And then I will just conclude with, for me, the greatest aspect that came out of Porto, and you will have to know that every professional in sexual health and rights enters this space with a specific agenda. There are rights activists that push for rights primarily. They are the CSE people that push for that primarily. Some people push for things in a particular region. And whenever I speak, you know I'm going to push for Africa. But as a professional in sexual health and rights that comes from a continent where there's almost no training for us available on the entire continent, the professional training is really something that's important to me. And something that came out of this meeting was a board that will be formed now that consists of all of the heads of department of universities where there are already sexual health programs on an undergraduate level, on a postgraduate level, and where we will be able to develop global standards in sexual health training in all the various segments in order to give regional bodies the authority to do regional accreditation in order to be able to eventually do it on a country level. So that's the big plan. And this is something that we've been dreaming about for a long time, because I realize that we can't do it in Africa without these global standards being set first, and then of course making sure that it's absolutely Afrocentric when we apply it on the continent. But I will conclude with just reading this statement to you, because I don't want to miss something. It says, comprehensive evidence-based education in sexual health is not just about clinical accuracy or public health impact. It is transformative in its force. It shapes how providers care, how systems respond, and how societies evolve. It equips professionals not only with knowledge, but with the values, the ethics, and the skills to challenge stigma, affirm dignity, and to serve with competence and compassion. Universities are not neutral spaces. They are intermediaries of social justice, and they hold the power and the responsibility to advance equity through education, research, and policy leadership. When universities embrace sexual health education as core public health and human rights, they contribute directly to the Sustainable Development Goals, from gender equality and health for all to reducing inequalities and building inclusive institutions. And I firmly believe that that is what happened in Porto, and that it will not stay in Porto. And I will make it my personal mission to make sure that that particular aspect is driven forward in the time to come. So thank you again for everyone that made this possible. It is an amazing, wonderful team effort of dedicated professionals, and it's an honor for me to be a part of it.
Thank you, Elna. Thank you very much for this usually inspiring talk. And definitely from Porto to every nation, and also from every voice to every heart. That should be our logo and mission. And now from South Africa to Australia, I would like to welcome our next speaker, Dr. Christopher Fox. He is the current president of the Asia-Oceania Federation of the World Association of Sexual Health. Christopher has been, for the past 25 years, a lecturer, a researcher, an activist on sexology, human sexuality, working with issues of sexual and gender diversity, a specialist in psychosocial and relationship therapy practice in Melbourne, currently in one of Australia's oldest and largest psychosexual therapy service. I'll definitely remove the oldest and keep the largest. He is frequently asked to consult on issues related to human sexuality, sexual health, and well-being. We're very happy to have Christopher on our team, and currently the president of the Asia-Oceania Federation. He will be talking to us about the impact of Porto Proclamation, the Asia-Oceania, the Asia-Pacific considerations. Chris, and you have
Thank you, Faysal. Thank you, Faysal. Good morning, everyone. I'm not the oldest. There are people much older than me in Australia in practice. However, by practice, sex life therapy is probably one of the oldest practices here in Australia. Woman Jeka and welcome. Woman Jeka means welcome in the language of the Wurundjeri Woi people of the Kulin Nation, the traditional owners of the land of Naarm, which is the name for the area that encompasses Melbourne or colonial Melbourne. I'd like to begin this morning by acknowledging the Indigenous owners past and present of this land from where I'm joining the meeting. It always was and always will be Aboriginal land that was stolen. It's currently 1:23 a.m. I am reading notes because I have no confidence in my ability to stay on topic and within time. So please excuse me as I read more than I speak off the cuff. And I'm speaking as the president of the Asia-Oceania Federation of Sexology. I'm also co-director of Sexual and Reproductive Health in the Faculty of Medicine at the University of Sydney. The Asia-Oceania Federation of Sexology is the largest federation by geographical area with approximately 50 countries. As a region, we stretch from South and Central Asia throughout the Pacific, incorporating Australia and Aotearoa, New Zealand. The Asia-Pacific region also contains the two most populous countries in the world, India and China. The socio-politics of the region, along with its ethnic and cultural diversity, provides opportunities for the development of unique approaches to supporting and ensuring sexual health and well-being, sexual rights and sexual justice. And the greatest challenge faced in implementing the Porto Declaration, I think for us, and this is not unique to the Asia-Pacific region, is not engaging in strategies and behaviour that are reflective of a colonial past or a neo-colonial present. And I think this is really, really important. And I'm very conscious of the fact that I am a white cis male speaking on stolen land. Strategies need to be localised to the country and within countries. The universality sits in the intersection of health, rights and justice, and these can only be achieved by addressing all three domains. The Porto Declaration is the first international declaration of strategic priorities advancing sexual health and well-being, sexual rights and sexual justice. It at once is agreed strategic plan, and it is at once an agreed strategic plan and an international agreement on action. The Porto Declaration as an international agreement provides further political credence and power to working with sexual health and wellbeing, rights and justice throughout the world, and for us here in the Asia Pacific region. I'm going to speak to 4 of the 7 priorities that we identified in the Porto Agreement. The first is strengthen sexual health rights and justice. WSHA Federation of Sexology commits to advocating for sexual health and wellbeing, rights and justice through advocacy with regional agencies and civil societies, local non-government and community-based organisations, as well as national governments. At a community level, the translation of the sexual rights and sexual justice declarations into local languages and support the development of in-country advocates will facilitate the strengthening process. We're also going to look at the second priority, or the priority: promote and protect universal access to high-quality integrated sexual health services, comprehensive sexuality education and professional training through the development of comprehensive CSE networks within the region, and the creation, as Elna has already spoken about, the creation of an international network as well as a regional network of university human sexuality and sexual health programs. As a director of sexual and reproductive health in one of Australia's largest universities, it is the avenue for which we can affect the professional education and therefore affect how sexual health and wellbeing, sexual rights, sexual justice is implemented. And it's also through the integration of sexual health and wellbeing, rights and justice into the broader curricula of university programs. So what are the challenges we have in my university is trying to communicate that sexual health isn't something that is taught uniquely by itself, but is something that we integrate across the medical and allied health programs. And also, of course, for me, with my interest in sexual rights and sexual justice, also trying to incorporate the idea of sexual rights and sexual and reproductive rights into our teaching programs. The other priorities are integrate sexual health rights and justice through facilitating regional collaborations of key players and advocating for rights-informed and justice-informed sexual health and wellbeing policy with national and state-based governments, something I'm active here in Australia in trying to inform the various jurisdictions. We have 7 jurisdictions in total around their sexual health policies, incorporating a rights-informed approach. And finally, the fourth priority that we're focusing on, or I'm speaking to tonight, is to ensure sustainable and equitable funding for sexual health rights and justice through advocating for regional agencies and developed nations supporting and responding to the sexual health challenges in the region. At the moment in the Pacific, Fiji, and we believe subsequently many of the other Pacific Island communities and nations are experiencing a surge in HIV infections that hasn't been seen in the region for over 20 years, and advocating for the continued support of countries of Australia and New Zealand in the interventions and the services that are now being provided in Fiji, as well as providing support to the government in developing or enhancing the professional responses. So they're the 4 areas. The Porto Declaration, I think, is key to the advancement, and I think it's the idea of the World Sexual Health Assembly is a way for us as an international community to actually give power and credence to, for example, the regional federations to feed down to and their member organisations and the member states in some cases to advocate for better sexual health and wellbeing, sexual rights and sexual justice. Thank you, Faysal.
Thank you very much for this. It's so good for somebody like almost falling asleep. You really did well. Thank you very much for highlighting the angle that relates to the Asia-Oceania Federation. Our next speaker is our dear friend Bouchra Assarag. Bouchra, where is Bouchra? Yeah, Bouchra is here. Our friend Bouchra comes from Morocco, and currently she is the EMFeSH president. She is the East Mediterranean Federation of Sexual Health under WAS. This is the newly founded federation. She is a doctor in public health and has a master's from the National School of Public Health in Rabat, Morocco. She is the coordinator of the Africa Francophone Hub of the Sexual and Reproductive Health Matters Journal, and she is also a member of the National School of Public Health. She has been involved heavily in education and research and in outreach that relates to sexual and reproductive health. She's also the coordinator of the primary healthcare training modules on Assarag and migrant women. And she continues to work also on research on how to have a proper access to Assarag and access to obstetric care, quality, and respect. And she will be covering the reflections of Porto Proclamation on the East Mediterranean region. Bouchra?
Thank you, Faysal. Hello, everyone from Porto to MENA region. It's an honor for me to be part as speaker in this important webinar about the impact of the Porto Proclamation on sexual health, rights, and justice, and how its vision resonates deeply in the Middle East and North Africa. When the proclamation was signed in Porto, it marked more than a symbolic moment for me. I felt immense joy of the Porto Proclamation, a historic moment that transformed our advocacy in our region into shared global commitment to sexual health, rights, and justice. Being part of this renewed my hope and strengthened my conviction that together we can turn the vision of sexual justice into lived realities across all regions, including our MENA region. I reaffirmed that sexual health is inseparable from human dignity and sexual rights are human rights, and that sexual justice is a necessary pathway toward equality, inclusion, and peace. For me, in our region, the principle of the Porto Proclamation, equity, inclusion, accountability, and evidence-based action are not abstract ideals. They are now, for us, urgent needs. Many countries in MENA are witnessing, as Morocco, growing inequality, restrictive laws, and taboos, cultural and social norms that limit access to sexual and reproductive health services, especially in rural women, youth, migrants, especially irregular migrants, and persons with disabilities. Sexuality remains a taboo subject in our countries, and conversations about sexual rights and justice are often silenced or politicized. We have also lack of financial resources, and structural inequalities remain deep. Gender-based violence, earlier marriage, and lack of access of safe abortion services continue to threaten lives. Misinformation also and censorship around sexuality persists, reinforced by constrictive interpretations for morality. Migrants, especially irregular migrants, are left behind, even if you tell that we don't left anyone behind. In most sexual reproductive health programs, facing multiple forms of exclusion. For that, the Porto Proclamation remains as that justice requires redress and reparation for those whose rights haven't been denied, including survivors of sexual violence and those criminalized for their sexual orientation, identity, or reproductive choices. Sexual justice, as defined in Porto, is not only about health systems. It's about transforming, as said by Faysal, the structures that produce this inequality: legal, political, cultural, and economic. In this way, the silence in our MENA region is being challenged by hopefully by a new generation of young decision makers, researchers, and activists who are breaking barriers and promoting culture of rights and respect. The Porto Proclamation gives us legitimacy and a global framework for this movement, linking our struggles to a collective international vision for sexual justice. Despite the challenges, the MENA region is changing. She is between aspiration and contradictory reflections. We have like comprehensive sexual education. It's been slowly introduced through schools, but not in community, in many countries like Morocco, Tunisia, and Lebanon. Also research and evidence generation and growing, and using new methodological tools based on human rights and sensitive to gender, thanks to regional collaboration such as the Francophone Africa Research Hub and academic institution committed to documenting realities and inequalities. Also, with health professionals are being trained to provide person-centered and gender-sensitive care, integrating, but not yet for sexual pleasure and informed consent. Also, civil society is building bridge between health, education, and justice sectors, as called for by the Porto Proclamation. These are not isolated action. They represent the seeds of sexual justice in MENA. For the MENA region, the Porto Proclamation is both a mirror and roadmap for us. Mirror because it reflects our gaps and contradiction between law and reality. And roadmap because it's point to concrete priorities, reforming laws and criminalize sexuality and reproductive rights, investing in youth and women-led movements for sexual reproductive health rights, ensuring funding equity so that MENA-based initiative can sustain their impacts, and promoting cross-sector solidarity, health, justice, education, and technology to counter misinformation and digital censorship. As the proclamation insists, accountability advances sexual justice by dismantling systemic inequality. This is our collective responsibility to transform the Porto vision into tangible progress for all communities without exception. In alignment with the guiding principle of the Porto Proclamation, after my return from Porto, we had in EMFeSH, we organized a meeting, and we discuss about this Porto meeting and the Porto Proclamation, and we start to integrate it in our action plan 2026-2028, and we prioritize comprehensive sexual education as one topic. Following a dedicated meeting on the proclamation, member collectivity prioritize our member promotion of comprehensive sexual education as a key lever for advancing sexual rights, equity, and justice in the region. The plan emphasizes training the capacities of health professional and educational to deliver evidence-based, rights-oriented, and cultural sensitive sexuality education. It also includes strong research components with mentorship program designed to empower young researchers in the region. Through this initiative, EMFeSH aims to operationalize the Porto Proclamation commitments, promoting inclusive education, intersectoral collaboration, and the recognition of sexual health and rights, fundamental human rights. In closing, the Porto Proclamation is not just a declaration for us. It's a call for unity, courage, and transformation. In the MENA region, we're speaking about sexual rights can still be an act of bravery. It provides us with language, legitimacy, and solidarity. Let us make Porto not the end of process, but the beginning of a renewed movement of sexual health, rights, and justice, one that speaks in Arabic, Amazigh, French, and all the language of freedom and dignity. Thank you.
Thank you very much, Bouchra. Definitely we will. As you said, it's not only a roadmap, it's more than a roadmap. It's a whole change, and it's a whole movement that all of us, all the federations, all the partners will help push and move forward. I'm glad to introduce our next speaker, Miranda Van Rooijk. Miranda is a medical anthropologist. So she has the other beautiful vision on things. And she is the manager of the Rutgers Research Unit. Her expertise are wealthy as expertise, not wealthy as in money, healthy and positive adolescent sexuality development, comprehensive sexuality education, and participatory action research. She is a champion for meaningful and inclusive youth participation in sexual reproductive health and rights research and programs. Miranda will be addressing us on how the Porto Proclamation can support the way forward, specifically in relation to comprehensive sexuality education. Thank you, Miranda, for being with us.
Thank you so much, Faysal, and it's an absolute honor to be here and to share a few words with you. Yeah, I prepared a couple of slides. Don't worry, they're not too many, but I want to also share some links with you. I want to talk a little bit about why we at Rutgers were grateful to join the Assembly in Porto and sign the proclamation, and speak a bit on how I think the Porto Proclamation can support the way forward for a comprehensive sexuality education. Because in the past year, we've been working on a forward-looking agenda for CSE with a bunch of people and a couple of partners, because there are so many things changing in the world, right? And Elna spoke to that. I think there's so many rapid changes, and these include, for instance, the digital realities and influences on young people's development and behaviors, the organized anti-rights, anti-gender movement, the outright attacks on sexuality education and our organizations, the SRHR organizations, large-scale mis- and disinformation. We see, of course, the influence of toxic masculinities on the internet through the manosphere, severe budget cuts to SRHR programs. At the same time, we also see that the new realities come with some opportunities for sexuality education. So there's more, there are digital innovations, more opportunities to reach young people with CSE digitally. We also see increased support from parents for sexuality education because they worry about the online influences and safety of their children. And we can build on strategies of SRHR organizations that are successful in implementing and scaling sexuality education despite difficult and challenging contexts and opposition. So if you're interested in learning a little bit more about the background of all this, we've written a white paper, and you can find the QR code over there, and I'll share the link also in a little bit. But what came out very clearly to us by doing this work also, and talking with partners and working with partners, is that need to share strategic information and the strategies, the tactics, the messaging frameworks, the materials, to really learn from each other and strategize together, and to become more proactive in anticipating and countering the anti-rights and anti-gender strategies. So you can imagine how glad we were that the WASH took the initiative to organize the assembly in Porto to discuss how we can do this and about the commitment from all these beautiful people and organizations that were there to stand together and work on the priorities some were mentioned. I think important next steps for us as signatories, but also all of you who are listening and our allies and partners and the people doing the frontline work, is to think more about like how can we do this? How can we operationalize this and translate the commitments into a joint plan of action? For instance, like what channels and what platforms and what working groups can we leverage to strategize and share, but also what next moves do we see coming from the anti-rights and anti-gender movement, and how can we proactively mobilize to counter this? And there's more of these questions that we would love to discuss with you and of course with the signatories of the proclamation. And I think Faysal also shared some of the avenues that are there, and one of them is upcoming, of course, the ICFP in 3 weeks' time. And in case people are going there, we would really warmly welcome them to join us for the CSE pre-event sessions, for which you find the link here, to continue our conversations on how we can do this together. Thank you. I'm going back to Faysal.
Thank you very much, Miranda, for this interesting presentation, and also for the energy that you're keeping, that we're gonna keep together to do the transnational efforts to push forward the CSE more and more. Thank you very much. It gives me a pleasure to introduce our next speaker, Susana Medina Salas. Susana leads the program implementation unit at FOSS Feminista, and she has over 20 years of extensive experience in the field of sexual reproductive health and rights throughout Latin America. She has a bachelor's degree in psychology from Universidad Católica and Rebello, as well as a specialization in psychosexual intervention in communities and masters of social psychology, bringing together all these disciplines, expertise, and specialties to talk to us today about the relevance of the proclamation for the sexual rights, health, and justice movement.
Thank you, Faysal. Thank you for inviting FOSS Feminista to be part of this conversation. We are very happy to share our reflections about what happened in Porto at the inaugural session of the World Sexual Health Assembly, where we met with many other actors of the field to discuss the status of the sexual health in the world and to strategize our collective actions. FOSS Feminista is an international alliance for sexual and reproductive health, rights, and justice, and we are one of the civil society organizations that are signatory of the Porto Proclamation. For us, the proclamation is the result of an open dialogue between diverse actors working for a long time on sexual health. It came after several discussions of the core elements that should related to sexual health, rights, and justice that should be part of it. I guess that we did a democratic exercise where we were able to use our diversity to build a common agreement on the principles and strategic priorities to advance sexual health, rights, and justice. There are 3 elements of the Porto Proclamation that I want to highlight from our perspective as an intersectional feminist alliance. We consider that these elements might be opportunities for the future of sexual health. First, bodily autonomy as a precondition for sexual health and sexual rights. It is the power to decide on our bodies, the power of the agency of people. The recognition of this power dynamics, this political dimension around our bodies, is reflected in the Porto Proclamation. Recognition of power is also a critical component to growth as a collective, of course, and to advance sexual health and rights. Second, our agreement moved forward from a rights perspective to a sexual justice framework, which means that it is not only about the affirmation of sexual rights as human rights. It goes beyond. It recognizes that sexual rights are indispensable to advance social justice. Third, bridges. We are contributing to movement building, creating bridges and alliance among different stakeholders such as researchers, health providers, educators, advocates, activists, governments, multilateral and social movements. It is essential to ensure systemic changes and to make sustainable the advances. From FOS Feminista, we celebrate the Porto Proclamation as our joint action for sexual justice and social justice. Solidarity grows because we act together. And we think that this Porto Proclamation is a tool for collaboration and actions to achieve health, justice, and peace for everyone. Thank you.
Thank you.
I guess that you are mute, Faysal.
I'm mute. So I was saying thank you very much for putting down a clear strategy on how to move forward with this and on the importance of the new level of sexual justice that will really meet up the efforts of sexual rights and sexual health. Last but not least, our dear friend Esther Kishmodi. Esther is the Chief Executive of the Sexual Reproductive Health Matters Journal, and she is a human rights lawyer with international recognition and over like 25 years experience in global health, law, and policy on Assarag. She has served on the WHO, and that's where we first met. She was there the first day, and I was there the first day for some expert meeting. And also she served as a senior advisor at UNAIDS and consultant to UNFPA, UNDP, and UNHCR. She has also landmark initiatives. She was part of those initiatives on sexual rights law and policy, on reform efforts on SRHR, legal gender recognition, and also in the important ICD-11 reform on sexual health and that brilliant chapter on sexual health on the ICD-11. She's also in the academic realm, teaching sexual rights at 3 or 4 different universities around the world. She is a visiting fellow now at Yale Law School Global Health Justice Partnership, and of course, an active member of the WAS Executive Committee and the chair of the Sexual Rights, Health and Justice Committee at WAS. Well, Esther will not be making a speech. We ask Esther to really conclude and reflect on all the speeches that have been presented this time. So please, Esther, go ahead.
Thank you so much, Faysal, and thank you for everyone. I think Faysal and Christopher, Bouchra, Miranda, Susanna, all your interventions really demonstrate how the Porto Proclamation is providing a momentum and a turning point when we are moving from a first shock of defensiveness on defending sexual health and rights and sexual and reproductive health and rights because of political turnouts at the global and many local and regional level. But it's really an energizing momentum when we are bringing together science and knowledge to action and activism. And we are recognizing how much opportunities we have despite of the difficult moments. And I think each of your presentations and interventions are demonstrating it as much as our one day in Porto demonstrated it. I think it's very important that the Porto Proclamation is situated in a political momentum in 2025. That is a difficult political momentum because of various issues, because of ideology versus ideology-based policies and politics and programs and provision of services, but also because we are at the scientific development than never before that provides opportunities for access to services if it's provided in a just way. It's beautiful. We are also political, and we recognized in Porto it was beautiful to see Amal Avadallah in the participants list. Probably she needed to leave from Palestine, who is an executive director of Palestinian IPPF, who reminded me that I just most recently visited Beirut, the American University of Beirut, at the Aswari Institute of event on transitional justice, how women's voices and collective voices can claim peace processes. This is a momentum when we need to situate, for example, that in post-conflict, in conflict on war, how we situate the importance of sexual health and sexual and reproductive health. And this is where the Porto Proclamation and the networks and the connections that the Porto Proclamation and the implementation provides to us. Your presentations also was very clear that it's not just a declaration, it's an implementation framework, it's a roadmap towards accountability, implementation, how we bring together the principles of rights, justice, and health into laws, policies, services, and education. When our framework is not punitive, but our framework is access and accountability, that driving legal reform and policy development, community action, ensuring professional training and clinical services at local, national, and regional levels. It's also, Faysal just mentioned that we focus on the opportunities. WHO first ever introduced the sexual health chapter on the WHO International Classification of Diseases 11, ICD 11, that really provides the framework for implementation that is a matter of rights and justice in terms of affordability, as Bouchra said, collective equality, and towards professional training that is not the luxury of some, but it's integrated into primary education, professional training of sexologists, but also OBGYN. We just came out of FIGO when WAS was represented together with many organizations who are here as well. So we are focusing on the positive. We also want to connect to frameworks that provides new opportunities. Our journal, for example, just published a framework on the right to science and sexual and reproductive health and rights, that it's really reminding us that the right to science exists instead of silencing science. And it connects us to a recent webinar when, for example, Faysal participated on a systematic review that WHO carried out with the Pleasure Project on sex satisfaction and contraceptive research that shockingly showed, or less shockingly, how contraception and sexuality is connected to each other, and surprise, surprise, how contraceptive use in affordability, switching is connected to the lack of recognizing that why we are taking contraception or why we need abortion, because we are having sex, and how bringing pleasure, intimacy, and lived experiences into sexual and health research and practice has an importance. So I think the Porto Proclamation and all of your interventions show this really provides a turning point when we are bringing together all different organizations, all different actors. Bouchra situating her intervention in a restrictive environment, both culturally and from a religious political perspective, yet sitting in a country, as mentioned, where there are most progressive laws and policies, where the provision of sexual and reproductive health services for migrants is set on the same rights as citizens' rights, providing a framework that can be followed by others. So we are not only top down from global to local, but we are here as well to learn from communities, from positive governance, from state accountability that makes sexual health rights and justice accessible for everyone. I think what the Porto Proclamation is most importantly stands for, as Renee and Elna pointed out in their opening speech and opening remarks, that it's provide, instead of fragmentation, and opportunity for cross-movement solidarity and action when we are considering governments, civil society, communities, scientists, and researchers as a global community who stands for upholding sexual health rights and justice. So I'm very excited how we are bringing the Porto Proclamation to different spaces, from FIGO to ICFP in November in Colombia, but also to local and community action, like the Momentum at Diaspora Institute about transitional justice and sexual and reproductive rights in Beirut, and many other places. So I'm very happy that we are taking the Porto Proclamation forward in many different ways. Thank you.
Thank you very much, Esther, for showing us also the different perspectives that the panelists brought in pushing and promoting the proclamation, which I think it is one of the ways that we all have to move together, all the global partners, all the global collaborators, because we all believe that sexual health, rights, and justice are essential components of our overall well-being and overall justice in these difficult times. If we have any questions, you see anything, Renee, in the chat, any specific?
Yes, so I did receive some anonymous questions, and I will read that. To the panelists, was there anything during our time together in Porto that surprised you in a good way? For example, something that surpassed your expectations? And was there anything that stood out that highlights concerns and therefore the need for this proclamation at this specific time? So I don't know if who wants to start, but I think you can, those who would like to answer this question, please do. Elna, will we start with you to give it a shot?
Thanks, Renee. I think at WAS, we are quite used to dealing in a very multidisciplinary way, and we are used to really putting everything on the agenda. But I was quite surprised to hear how certain sectors felt like they've never had an opportunity to speak to people from other sectors. Although we're all working towards sexual health and rights, their paths never collide. And it was surprising to me, but also really very positive to think that we did create this opportunity for everybody to engage, and all of the potential that sits in these collaborations going forward.
Anyone else from the panel who would like to answer that question? Who's going to volunteer, or should I pick on people? Esther? do you want to answer that question, please?
Oh, sorry. I'm just cruising through the other questions. I think the beautiful moment for many of us was to really listen to the. Sorry, I'm muted. I am muted. No. And really the different, very different perspectives. I really appreciated that we were in Porto, hosted by Pedro Nombre and their groups that is really who are running a fantastic institute on sexual medicine, who is a very multidisciplinary group. And it's really showed that how a local university in a country where that actually had the first ever policy or law on sexual health that is recognizing sexual health in a law and policy, was hosting as an event who is how we are from a local regional perspective, we can be global. I think it was not surprising, but I think it's very important to emphasize that it was about 30 different institutions across the globe from different disciplines and sectors were together. And it's not a surprise. I think it was very intentional to not to be kind of exceptionalizing that these are the institutions who are important, but start something. And each of the institution was symbolizing another 50 institutions like WHO or UNESCO in the room were standing for the UN agencies who are working in different sectors. Force Feminista, ILGA in the room were bringing the voices of another 50 institutions around the world. So I think we recognized our limitations, that we were only 30, but we also recognized our power that the 30 stood for 500. So I think it was a very powerful perspective from that side.
Now, yes, Miranda, please, we want to hear from people outside of WAS as well.
Yeah, I just want to share, like, it was just brilliant to be in that room and to feel the leadership. We feel solidarity with a lot of the partners working out there on this topic, but it is so incredibly important to hear leadership from the UNs, from the larger organizations that tell us you're not alone. We really encourage you to be brave, to speak out. We have to be out there. We have to publicly defend. And it is counterproductive if we sit quiet and wait for the storm to pass, because it will not pass. And it will become worse if we don't step in and do this now. And I think that was super powerful, super encouraging. And we need to hear that from leadership. I think everyone who is struggling in the current circumstances, I wish for them to have heard what I heard in that day, and I hope we can really carry those messages and share them out there, because I know that there are so many organizations and people who want to join this agenda and who want to join this movement. And I think that's the biggest task for us now, is like, how can we organize that? How can we channel that? So I'll stop there.
Thanks, Miranda. I really also just want to perhaps latch on to what you say. Often when we deal with situations or, really complex problems like these, we think about it as a wicked problem, something that is so difficult to solve. And I think what really surprised me is the simple answers that were given. And just to speak to what you now said is, it is now for each of us to take that responsibility and tell people about what we experienced and the messages that we shared. And it is for us to take this responsibility forward, not only in the organizations where we work, but on a very personal level, you know, in every conversation that we engage in and everywhere we go, to share with people what is really happening and how we can move forward. And the simple message that touched me the most is really this relationship, this message of building relationships with other people and building trust. And you know, that's really what is the World Association is trying to achieve by reaching out to all our fellow organizations and asking everybody to work with us and join hands and to take this movement forward. I am now going to look at another question, and then perhaps I'll pick on Susanna and Bouchra to answer the next one. And that, well, what are the concerns really for you that you realized are the concerns raised in the proclamation, and how can we move forward? So which concerns, you know, were highlighted the most, do you think, Bouchra and Susanna, whoever wants to go first?
I can start. Thank you, Renee. I think that what we found as a common concern, was is the current situation with the anti-rights groups speech, and how we are fostering solutions based on evidence, and how we are finding pseudoscience related to sexual health and rights. So I think that one key commonality that we identify is that it is important to ensure that education entails all these structural components of what's happening with access to services and education. I think that for us was not difficult to connect each other and to have more clarity together where are the gaps, and how we can even invite other actors. For instance, when we discuss about the involvement of private sector to join this effort, and to bring ideas to talk also about sustainability. I guess that sustainability was also another concern that we discussed, because of course of the momentum, the lack of funding, the difficulties for access to resources, especially for the national organizations, for the domestic budgets that are used for education and services. So I think that all these elements are linked, and what is positive, to wrap up in a positive way, is that we were able to name these factors, and we developed some actions that might be the roadmap to counter these elements, and of course foster a more enabling environment to the purpose that we have as a collective.
Yes, Esther, I see that you would like to respond.
No, not to this. Maybe Bouchra, you can go first, and I would like to respond to another comment in the chat after.
I think, okay, thank you. I think that's the concern, that's how can we lead with this growing restriction and the legislative laws and these disparities between, in the same country, we can have these disparities in discussion about sexuality, and how can we advocate and be more expressive with the person that are against what we want to implement with this Porto Proclamation. I think that's it's a good thing that if we discuss and we think how can we face to this the opposite of what we want to implement. And for the first things, I think that the first time that I spend less energy to convince other person, because we still all the day trying to convince the third person with high education and health professional. We have a lot of problem with them, and now we try. This is we advance, but this is losing for our energy all the time. And in the Porto, I think that all person are the same commitment, and the good things that they are. We have a lot of hope, even if we have the budget restrictive now, and we try to find solution for this situation in the world are against sexual reproductive health rights.
Thank you, Bouchra. Any other comments? Esther, would you like to speak now? Thank you.
Yeah, following on Bouchra as well, and I think Christopher probably had to leave because it was just extremely early morning for him, but he mentioned colonization, and I think we touched upon very deeply that colonization and decolonization, whether it comes to how we are creating evidence or how we are situating sexual and reproductive health services in certain social, cultural, socioeconomic context, is connected to decolonization or the criminalization of sexual orientation, sex work, surrogacy, and restrictions on gender expression, is how it's connected, the criminal laws, to colonization. But it's also how colonization, decolonization is connected to power and power structures. So colonization is not only stands for the actual colonial power as it stands in history, but it also represents how power structures are functioning in society, that is connected to the justice framework that was just introduced in the new declaration. And I find a lot of beauty, and I wouldn't call it challenge, but opportunities, how we bring the health, rights, and justice together in as many ways as possible, how we recognize that we have a right to life, to right to security, right to health, that has an impact, how the rights are being upheld on our physical, mental, and social well-being. And it is an accountability of government and states, how these rights are being upheld. But these rights are situated in a social, cultural, religious, and political framework that is a matter of social justice. So I think the Porto conversation brought this very nicely together. So while we had this conceptual framing, I just would like to address Diana Hunter's on the chat point as well, that is very specific. I think we cannot just stay in the general and make big proclamations, but we also have to go to the nuances. And Diana, you speak in the chat about the institution of sexual surrogacy and sexual assistant for people living with disability. These are exactly the nuances that we need to address in relation to the Porto Proclamation, but also in relation to the vast declarations on rights and justice, that how people who are situated by societal disadvantages in certain situations, like people living with disability, should be able to have access to sexual health services, but also access to experience their sexuality and sexual pleasure. And we have examples around the world, like in Australia, or I'm situated in Geneva, when the institution of sexual assistance is reimbursed for people with disability, is reimbursed through the health insurance system, and sex workers, that is completely legal in the canton of Geneva, when sex workers' rights are recognized as labor rights, they have the right to maternity leave and unemployment benefits and whatsoever, are trained to provide services for people living with disability. So I think, Diana, we would love to hear from you more what you are doing and go into these kind of specificities when actually the justice, the services, the rights frameworks can be taught to each other across the world, how we are upholding such important good initiatives.
Thank you so much, Esther. It is always such a privilege to be on a webinar where probably the collective experience and knowledge in the room surpasses like 120 years of wisdom and knowledge in comprehensive sexuality education and human rights and sexual health and rights and justice. So thank you for that great intervention. Now I just want to probably ask this question to Elna because it's about the way forward and the path forward. How can people and organizations that were not part of the inaugural World Sexual Health Assembly get involved and or join in the movement and the momentum that was created?
Thank you, Renee. Yes, one of our values within WAS is definitely consultative participatory processes. And as Esther very accurately stated, that everyone in the room represented so many other people, and we definitely want this to be owned and then really individualized and implemented in a very culturally specific way globally. It will be wonderful. And not only culturally specific, but which is something we spoke about, because culturally specific might actually mean omitting certain of the rights and justice elements that we so strongly push for. But, implemented within the context, and then to get feedback of, what is it that we're missing and how should we be adjusting this moving forward. But we needed to get all the original signatories on board. Some people needed time with their boards to be able to officially sign it, the people that actually put it together. But now that we have that more or less in place, we will give an opportunity for people to officially sign on to the Porto Proclamation, to say, me in my small group clinical practice in South Africa, we support this. And in the way of delivering clinical services, we are going to do it aligned with this proclamation. And if you have an educational institution, you do the same. If you are a civil society organization, you do the same. And then the idea is for us to learn from our every organization, to make sure that when we go to the next meeting, that we do represent the needs and the voices of all of the people that we represent by being the person in that room. So, and then also what's very important, what we said from the start is, WAS is the convener of this assembly, but it's certainly not there for us to project our own agenda onto what should happen here. We had only one day. We worked primarily on setting the scene and then putting forward the proclamation. We are working on a plan of action now that came out of all of the things that everyone put on the table. That will be published as soon as we could get that together and everyone to agree on that next step. And then we will start to do some programmatic work that flows out of what happened in this one, for us as a group, but then encourage people to be doing their own programmatic work. And at the next assembly, I think we will get more of an idea of how do we see it moving forward for the next 10 years is what I suspect.
Thank you. And just a reminder to all our participants and audience, we already know that the second World Sexual Health Assembly will take place on the 4th of September, on World Sexual Health Day in Nairobi. So we already know people can start planning for that already. And I think it might be also important. I would not be a good executive director if I don't mention funding. We are still very open to receive funding. So if people want to give us funding for the assembly, you are more than welcome to send me an email and work in ways together of, how can we fund the assembly going forward? I think I want to just give an opportunity to the panelists to perhaps give any last comments if you wish to do so. And after that, I will close this webinar. Any comments from the panelists? Bouchra, you look like you want to say something, but
Yes, the last comment that we must be together and try to implement the Porto Proclamation and not be only in the paper. And with this webinar, I think that the practical ways that we can counter the misinformation, that we must work practically, but not only have the slogans and assist the meeting, but in the field, and community needs us, especially the marginalized community. Thank you.
Yes, Miranda.
Thanks. Yeah, I was thinking about the ICFP because there's a lot of organizations, of course, coming together there and discussing similar things and exchanging and sharing. And I was wondering if the WAS sees a role of finding ways to help channel resources, materials, strategies, tactics that are being shared there. And if you see a role for yourself on how you can maybe disseminate that or help to make it more accessible, readable, etc.
Yes, thank you. Susanna.
Yeah, I would like to close my intervention leveraging to respond a question in the chat about sustainability, because yes, sustainability is key for the future, is key for planning and for implementation. It is not only a work that we need to do with governments. We also need to look for solutions, innovative solutions for financing, for social innovation. I think that there are a lot of knowledge and experience on the field about how can we support each other as ecosystem that we operate, not only international, but also regionally and nationally. And there are several resources that we can even leverage, not only in terms of financing, but also in terms of developing technology, using technology, and of course, keeping advocacy for governments to understand why it's so important, sexual rights for democracy, for peace, and for justice.
Thank you, Susanna. Elna, I see your hand went up.
I just want to respond to Miranda to say that, yes, we will be at the ICFP and we will certainly be there, like in humility, to see what it is that we can do to help to move this forward. We have not been very actively engaged on that particular platform before, but we've got big plans for that. So I'll see you there.
As always, was as big plans. I missed one question in the Q&A box, so just final comment. So the question is, are there plans to establish concrete timelines and performance indicators for the Porto Proclamation's priorities? And the answer to that question, I don't know if Elna wants to expand, but the answer is definitely yes. There are plans, and ultimately we are working on the world plan for sexual health and rights. That's the ultimate goal, and there will definitely be key performance indicators and strategic objectives linked 2 key performance indicators that are achievable in the short and then more ambitious for the long term. So yes, that is definitely all on the way. All I can say now is I want to say watch this space, but perhaps it was this space. So thank you so much to all our panelists and to the audience.